Hey everyone, welcome back to the Therapy Room with Javi. My name is Javiera Gomez. I'm a licensed professional counselor who specializes in couples therapy, individual therapy, and perinatal or maternal mental health therapy here in Chicago, Illinois. I am so excited to share with you guys this YouTube content, podcast, psychoeducational content around the pregnancy and just in general, everything that happens in the perinatal period. This is going to be a series of videos just kind of sharing psychoeducational content so that we can learn, understand, and kind of go through the motions of what happens during the perinatal period or other aspects of mental health in general. So today I'm presenting one of the topics that I'm most excited about, which is how pregnancy changes our brain in general and what happens with our brains when we are pregnant. So I am so excited to share this with you guys. Welcome back to this space. Before we begin, a few disclosures that I think are really important. This content is intended for educational and informational purposes only. It is designed to support understanding of pregnancy-related brain changes and to normalize common emotional and cognitive experiences during pregnancy. This content is not a substitute for medical care, mental health treatment diagnoses, or individual therapy. And if you have any concerns around your mental health, emotional well-being, or physical health during pregnancy, please reach out to a qualified healthcare or a mental health professional, a licensed mental health professional in your area. If you do have any questions, please link them down below and I will be happy to answer them for you guys. But if there's an emergency or if you have those concerns, please reach out to your providers. Okay, let's start with the basics. Why does this matter in general? Why do I think it's important for us to understand the pregnant brain and all the brain changes that happens during pregnancy? So many people experience emotional, cognitive, and neurosystem changes during the perinatal period without really understanding why. And without context, these experiences are often labeled as something is wrong with me. And with this something is wrong with me, there are usually emotions attached to it like blame, shame, fear, and just a lot of confusion overall. So, understanding the neuroscience behind this perinatal brain will help us reduce the shame, the fear, and the self-blame and support regulation overall. This is why it matters so much for us to understand what happens. Now, during pregnancy, the brain becomes more plastic and more sensitive to stress and emotional input, making support and understanding especially important. We're going to talk a lot today about the different supports that we can find or resourcing that we can do when we are going through pregnancy, and that will be helpful to support us during this vulnerable time in our lives. So, this is why I think today's content, today's video matters so much so that we can actually understand the neuroscience behind it and reduce that shame and that self-blame and actually give a name to it. Because let's be honest, not a lot of people talk about what happens when we're pregnant emotionally and cognitively wise. I feel like there is this lack of information overall that, it's important for us to fill up those gaps with psychoeducational, research-based information. Now, if you are a clinician watching this video, this is why this information is clinically even more important for us in general. Understanding pregnancy brain changes reduces self-blame. It normalizes the emotional shifts within our clients or patients. It helps differentiate adaptation from pathology and encourages early appropriate support. This is really important overall that we're going to see it throughout our video today how much early appropriate support is important as a preventative care during pregnancy. And this is why perinatal informed care matters, because the brain is different during pregnancy. We cannot treat the same client the same way, right? So if a client is pregnant, we're going to have to adjust and adapt to give that client the best clinical evidence-based support possible. And starting by understanding why our brain changes is something that will definitely help this client. And will help our treatment and how we help and how we show up for the clients or the patients in our clinic. Okay, so let's start with the pregnancy and the brain. Pregnancy is one of the most significant periods of brain change in adulthood. It's when we experience the most amount of neuroplasticity in general. Neuroplasticity, and how our brain makes connections, how our brain works in general, is going to be so important in this significant period of time. And we are most vulnerable during this period of time. During pregnancy, the brain really undergoes structural, functional, and hormonal reorganization to support attachment, emotional attunement, and protection. These changes are adaptive, okay? This is not a sign that something is wrong. This is actually what's supposed to happen. Our brain is supposed to go through these changes to help us adjust and prepare for motherhood and parenthood. So, this is something that is really important to not pathologize the changes that we are going to see today. By me sharing this information, by no means I intend to pathologize the changes, rather to inform and psychoeducate about the changes that we are going through, not as a sign that something is wrong, but rather to honor them and to go through them with the adequate support. So, many pregnant people notice changes in our brains, right? As forgetfulness, difficulty concentrating, feeling mentally slower, increased emotional sensitivity. And there's actually this term, pregnancy brain, that we're seeing more and more being used. But it really does have a negative connotation. When we talk about pregnancy brain, we usually talk about it through the lens of shame, self-blame. Oh, I'm so dumb. It's my pregnancy brain again. And today I want us to encourage you guys to encourage us to really change the narrative from a negative connotation of pregnancy brain to a positive connotation of course, pregnancy brain, because my body's creating a human and my brain is adjusting to all of these changes. So these experiences are often dismissed as just pregnancy, but neuroscience shows that they're linked to real brain changes. These changes have been studied for years now. And understanding this really helps reduce the shame and the self-blame, like I said, and kind of approach it from a much more self-compassionate perspective and acceptance perspective overall. Pregnancy is a neurobiological transition. Pregnancy is not only a physical process of growing a baby, it is a neurobiological transition. What does this mean? That the brain begins to reorganize early in pregnancy and continues adapting as the body prepares for caregiving and protection. And actually, some of the changes that we're going to see today are actually carried through the postpartum, because some of the changes that we're seeing are actually helping us prepare and adjust for motherhood or for parenthood. And this process is comparable to other major brain transitions, such as adolescence or puberty. This is something really interesting, actually. And there's a term for it, matrescence. This term, matrescence, was acquired to help us understand how our bodies and our brains go through this particular period from preparing to become a mom, right, or a parent, and going through this period of matrescence where our nervous system, our brains structurally, neurobiologically, structurally, hormone wise, we are going through this process through a major brain transition. And in another moment in our lives, we as women, right, or people who have female reproductive organs, they actually have gone through a transition like this before. the adolescence or the puberty is comparable to this other transition. And if you think back to how we experience adolescence or puberty, right? A lot of the symptoms or a lot of the changes that we're going to see today, even though they are structurally different, but they're going to be similar and they're going to make a little bit of sense as we go through today's class. So, this is such an interesting concept. When I learned about this, it made a lot of sense in a lot of ways around how we feel things, how we experience things, our behavioral changes, and kind of going through this major, because this is a major change, neurobiological change in our lives. Now, let's talk about the structural brain changes during pregnancy. Let's get to the meat of it all. Brain imaging studies show that during pregnancy, the gray matter volume decreases in specific brain regions. These regions are involved in social cognition and emotional processing. This decrease does not reflect brain damage or loss of intelligence. It reflects neural pruning. The brain becomes more specialized and more efficient. Let's think about it as a house being remodeled. It's not that one room will suddenly disappear. It's more so that we're giving energy to other rooms that might need the energy to function and develop adequately, to develop some skills that we might specifically need during motherhood or during parenting. Now, what is neural pruning? Neural pruning is a normal developmental process where unused connections are reduced and important networks are strengthened overall. Now, during pregnancy, this process supports the emotional attunement, sensitivity to social cues, and responsiveness to caregiving related information. It helps us create this connection with the baby that is going to be born, right? So, our brain, if we think about it as the pre becoming a mom, right? Or becoming a mom or becoming a parent, this process really helps us prepare for it, right? So the areas, the rooms, rather, if we go through with the same metaphor, the rooms that we are going to specialize or give more attention to are the rooms that are going to support our journey and our caregiving our caregiving responsibilities with the baby, right? So we might need to be more emotionally attuned to read those social cues from our baby. We might need to have more responsiveness to those caregiving related information, right? Like if the baby's fuzzy, if the baby has a particular symptom or overall changes, we might need to be more sensitive or be more responsive to be able to help raise the baby and to attend to our caregiving responsibilities. So let's think about it as the brain is refining itself for connection and protection. Those are very important words that we talk about all the time in attachment theory, right? We're here to connect and to protect. Now, why thinking can feel different when we are pregnant? Many pregnant people report that they struggle with multitasking, that they have slower word retrieval, right? Like, oh my God, I was thinking about this word, now I cannot retrieve it, feeling mentally foggy. And also, not to mention, and I do also want to make emphasis on this, during the first trimester, while we're going through the first structural brain changes, right? Where we're going through the first trimester where the symptoms are really intense. We might experience nausea, we might experience fatigue, we might experience extreme just tiredness overall. It's, of course, kind of related to feeling mentally foggy, right? Because if we're sleeping, if we're feeling tired, if we're feeling fatigued, we are going to be feeling or having more trouble multitasking, having trouble concentrating. This is sort of part of the symptomatology that we're going to experience in the first trimester. Now, research studies and suggests that attention and cognitive resource are being redirected towards emotionally meaningful and survival related information. And this is why it fascinates me so much the brain structural changes around pregnancy, because our brains are literally rewiring themselves to help us, right? to help us connect with the baby and protect the baby through giving other areas of our brain more attention and refining and changing those structures. The brain is prioritizing safety and connection over efficiency, right? So if you're pregnant or if you're planning to be pregnant, or if you went through it, you probably know that going through it feels, we might feel more tired. We might have no energy to concentrate and work, or things that we thought were important suddenly change. And we're like, why am I even thinking about this? Right? Because our brain is literally changing with us. It is prioritizing that safety and that connection over efficiency, right? Our brains don't care about America corporate, right? Corporate America, or they don't care really about productivity. That's not what matters here. What matters is safety and connection. And this is so fascinating. I know you guys can hear or see if you're listening to the podcast or see my emotion around this, but it just feels fascinating how our brains really do adapt and adjust to what's to come. Let's talk about the emotional threat and system changes overall. So during pregnancy, the brain's threat and emotional systems become, of course, more sensitive, right? Remember, protection and safety and connection. Now, this supports increased awareness of potential risks, heightened emotional attunement, protective instincts. However, this can also lead to increased anxiety, worry, or emotional reactivity. A more sensitive threat system helps the body respond quickly to perceived risks, but it can also feel overwhelming without the adequate support, right? So we might be feeling a lot of anxiety, worry, ruminating, overthinking, feeling overwhelmed during pregnancy. And this is because our emotional and threat system is activated and it's more sensitive because we need to protect the baby and we need to protect ourselves, right? So this is, of course, biological. This is all an adaptive biological response to becoming pregnant or being pregnant. Now, this sensitivity is adaptive. It is not pathological. And this is why it's really important for us, if you're a clinician, it is really important for us to be able to attune to that and kind of recognize some coping skills and recognize some techniques or interventions that might help pregnant people or people who are pregnant, right? That might help cope with this anxiety, worry, or this emotional reactivity overall. Now, of course, if we're talking about brain changes, we cannot leave behind the hormonal influence of the brain. Pregnancy involves dramatic hormonal changes that directly affect the brain. Key hormones include the estrogen and progesterone, which influence brain structure and mood, oxytocin, which supports bonding and emotional sensitivity, and cortisol, which interacts with stress regulation. Hormones change how the brain processes information and emotions, and these hormonal shifts directly shape how the brain responds to stress, connection, and emotional experiences during pregnancy. This can make emotions feel unfamiliar or more intensified, right? This is why we're feeling like I cry all the time. Something random makes me cry. I'm feeling more angry, more irritable, more reactive towards my partner, or I'm much more attuned to, I don't know, political changes or context in my life, right? Things that maybe mattered before but felt more manageable might feel a little bit more intense and more unfamiliar, sorry, while we're going through this hormonal changes in our brain. So this is something that will be, of course, important to recognize and kind of go through it when we are experiencing pregnancy or when we are pregnant. Now, why emotions can feel more intense, it's because emotional and threat systems are more active, like we said. Emotions may feel stronger or harder to regulate. Stress responses may activate even more quickly, and recovery from stress may take longer, right? This is why maybe when we get into a fight or a conflict or disagreement with our partner, we might feel like, oh, I just cannot let it go. I've been ruminating about it. I've been thinking, repair feels impossible. Or this is why we might feel like, oh, something triggered me. I got super stressed around work, and now coming back home, it takes me even more time to kind of go back to my baseline. Now, this reflects as a nervous system designed to be alert and protective during pregnancy, right? So, this is something that I want us to work on, particularly when we're experiencing pregnancy. Kind of this emotional regulation. It is normal that our emotions feel stronger or harder to regulate, which is why kind of being more intentional with our coping skills, with our distress regulation skills might be helpful, but also having more self-compassion during this time is also really helpful. And having those systems in place that will help us, right, hold all these changes that we're experiencing, right? For example, we might say to our partner, I might need more time to repair, or I might need to go through it again, or I might need a hug, or I might need more regulation or in co-regulation to kind of go through all of these emotions and all of these things that are happening in our body and in our brains. Now, when does pregnancy brain need support? Let's talk about that. While most pregnancy brain changes are adaptive, like we talked about, support is important when anxiety feels overwhelming, when intrusive thoughts increase, when emotional regulation feels difficult, and when daily functioning is affected. Now, remember, needing support does not mean that something is wrong or that we're going to immediately diagnose you with depression or anxiety or some other diagnosis that might affect you. It means that the nervous system needs care and that what we might need that extra help or that help in general, because this is, I mean, saying extra feels like a privilege. But it definitely, it is really important to have these support systems in place when we are pregnant because it is one of the most vulnerable moments in our lives, right? So it is a privilege to have access um, to mental health services, right? And although it is a privilege, kind of having those access to those systems or to that support that might be helpful is important, right? Or experiencing or getting or retrieving other resources that might be helpful during this time for you is important too, because we might need that support to help our nervous system, to help our brain, to help our emotions, to help our system while we're going through all of these changes all together. Now, what supports a pregnant brain, or what can we find helpful during this time? Research shows that the pregnant brain benefits from nervous system regulation practices, which can be meditations, can be breathing techniques, can be movement, somatic work, breath work, right? All those nervous system regulation practices will be helpful while we're pregnant. Of course, always check first with your physician, with your healthcare workers, providers, if we are able to do those nervous system regulation practices and what adaptations we can incorporate because we are pregnant. Safe and supportive relationships are one of the most important things while we're pregnant. I always say this to my clients and to other people that know me. We heal in relationships. And a lot of the things that I've been hearing from my clients and kind of being specialized in pregnancy, you never forget what people say or how people treat you when you're pregnant. Why? Because this is one of the most vulnerable moments in our lives. So if we're not feeling safe, if we're not feeling supportive, it'll increase stress, which will make it so much more harder in our bodies, in our brain structures, and in our connection with ourselves. So safe and supportive relationships are so important. And it doesn't matter if we have one, two, or a whole village with us, right? If we have that one safe, supportive relationship, we might need to nurture it and encourage us to keep that connection, that healthy, strong connection. Psychoeducation also helps, right? I hope that this video was helpful to kind of understand a little bit more about what happens in our brains. Trauma-informed mental health support, and not only trauma-informed, perinatal-informed mental health support, right? People that know how the brains work, how the perinatal period works is really important in our mental health treatment. Adequate rest and pacing, right? That's going to be really important. Self-care for sure. Taking care of ourselves, that's going to be really the base for a healthy pregnancy. And understanding what's happening in the brain can itself be regulating, right? It can relieve some of that pressure of, oh my God, what is wrong with me? I don't understand what's going on, right? Because we understand now that this is normal and this is an experience that a lot of people go through. Now, support during pregnancy is preventative. It is not reactive, right? We don't need to feel the most intense anxiety we've ever felt to find and seek for these resources, right? Rather, this is preventative. Even before getting pregnant, in the preconception stages, right? Kind of incorporating all of these practices will help for sure prevent, right? Some of that mental health dysregulation, some of that emotional intensity, right? And kind of just promoting nervous system regulation overall and a healthy mental health. I think it's important. Now, some conclusions for today. Pregnancy brain changes are real, adaptive, and meaningful. Your brain is not failing, it is reorganizing to support connection, protection, and emotional attunement during pregnancy. If any of this content resonates or brings up concern, you are not alone. Seeking medical or psychological support during pregnancy is a sign of care. Remember, it is not a weakness. And support during pregnancy can be preventative and protective. Pregnancy leads to long lasting changes in the human brain. Okay. And it is important for us, like we did today, to give it the care and the room for us to kind of talk about it and share this information and have, some discussions and some research around how much these long lasting changes impact us in general. These are some of the reference that I used today for this content. I really do appreciate you all being here with me in this space. If this resonates, please let me know in the comments what you guys think. Share this video with someone. And if you guys want to hear more about this content in psychoeducational format, or if you guys have a particular subject that you would want me to present or kind of talk about, I would be more than happy to review them. If you have any questions, you know that the comment section is always open and I would be more than happy to go through them with you. I appreciate you all. Thank you so much for being here with me and sharing this space. I hope that you guys have a great weekend, or wherever it is that you're looking at or you're viewing this content. I will see you soon. Thank you so much.